next webinar, we are very, very excited for our illustrious Dr. Brooks, who is one of our famed dermatologists, who is going to be talking about skincare. It was really interesting, or healthy skin, and particularly with the summer coming. It was really interesting. She sent me a message and she's like, so am I talking about skincare or healthy skin, or am I talking about skin cancer? And I was like, I kind of felt like as a primary care, they kind of go hand in hand and kind of go together. And I was like, you do you. So I'm really excited to hear what she has to say. So if you have any questions or anything, you can send it in the Q&A to either herself or myself, and we'll try to field those at the end. So Dr. Brooks, thank you so much for joining us.
Sure. So I just put together a little ad hoc presentation about the different kinds of skin cancer, and then a little bit about some sunscreens, and then really just you can ask me any question you want, and I'll do my best to answer it in an educated way. So let me open this. Korea.
Yes, ma'am.
When I say, so how can I share my screen? I'm like in.
Hold on, let me message our host. Oh, she can actually hear us, but let me message her just anyway.
Hi, Dr. Brooks. You should see a share button towards the bottom of your screen that has an arrow coming out.
Share, and so I can just share my screen.
Yes, correct.
Okay. Share, okay. Room. Okay, so this out of the way. So anyway, so it's May, which is Skin Cancer Awareness Month, because it's getting ready to be summer. So I decided to sort of focus on the skin cancer and prevention type stuff. But again, you're welcome to ask me, any questions regarding anything. I'm happy to answer. Anyway, so 1 in 5 Americans will get skin cancer by the age of 70, and that's all types of skin cancer: basal cell, squamous cell, melanoma, and Merkel cell. Basal cell, and again, this presentation, don't worry, it's not going to last the whole time. I want it to be a little bit interactive and you ask me questions because that's more fun for me. Anyway, so basal cell, most common skin cancer in the US, definitely increasing. A lot of people get it. So, again, 1 in 5 Caucasian adults will get a basal cell in their lifetime, so that's very common. Generally, these are not destructive. So if caught early, and they don't metastasize to other organs, but what they can do again is be invasive and destructive in the local area. So you can imagine, on the nasal rim here, or like on the helix of the ear, it wouldn't have to go very far to start destroying things. So there's several different subtypes of basal cell. Nodular, which is a bump. Superficial, which usually is kind of scaly and can sometimes feel and look like eczema. The pigmented variety, which is usually basal cells are pink, but in a small portion of them, they can be pigmented, and they can actually look really similar to melanomas. And then there's other kinds of basal cells, which kind of to the patient's eye sort of feel the same as the other ones, which basically is just a pink bump. These tend to grow over a period of months and years, and in some cases very, very slowly. But again, more invasive and destructive if left long term. So I stick actinic keratoses in here, which are not cancerous, but they are pre-skin cancer. They are more easily felt than actually seen. So if you close your eyes and rub it over your forehead or your nose or your cheeks, it'll feel sort of like a sandpapery feeling. And these are a marker of heavy sun damage, and that you need a yearly skin check. And sometimes if you have tons of them, even more frequently. And if you've seen me before, you've had these, you know, we do a couple things. We can freeze individual ones and that's sort of like picking the weeds. And then there's other ways to kind of like we spray Roundup, and that's good gardening. I'm planting my garden now. That's taking care of all the precancers that are underneath. So you're getting the things that you see and then preventing new ones from occurring. And that's by using a cream called either fluorouracil or imiquimod. Oh, there's a couple different ones. All right, now actinic keratoses, why are they bad? Because they can turn into squamous cell skin cancer. This one is the second most common type of skin cancer, and the second most deadliest as well, because it can spread to other organs, especially the ones on the head and neck. They are generally going to be scaly bumps that grow over months. Sometimes they will bleed, sometimes they hurt, sometimes they itch. And so these are also increasing in number, as are all skin cancers. This is what a squamous cell can look like. Generally a pink bump that grows. Sometimes they, again, itch or bleed, but you can tell this one on the left upper one has some texture to it. And the one on the right is a special subtype of skin cancer called a keratoacanthoma, which they arise very rapidly. They grow within weeks. All right, melanoma. Melanoma is the bad kind. And there's about 200,000 cases diagnosed and will be diagnosed in 2021, and around 7,000 people will die of melanoma. So it is lethal, especially if caught late, which is why it's important that if you have any risk factors for skin cancer, which I'll detail in a second. So any risk factors for skin cancer, it's good to get a yearly skin check. So generally risk factors are going to be a personal history of skin cancer, obviously. If you have had one skin cancer, you're at risk for getting the other types of, more of the same type of skin cancer or the other types of skin cancer as well. A history of blistering sunburns, and that's sunburns that actually have big water bubbles. And then tanning booth usage. So using a tanning salon 2 times before the age of 35 increases the risk for melanoma by 75%. That's a huge number. Blistering sunburn, family history of skin cancer. And then also if you spent the first 12 years of your life in a high intensity sun exposure area. So like, you know, closer to the equator, the worst. Let's see. So the sunburns definitely increases your risk. As I was talking about with melanoma, the later you find it, the worse the outcomes are. So, and late stage melanoma is actually more prevalent among those of color. And especially because a lot of the times when people of color, melanoma is more common on the palms and the soles. And that's not a place that a lot of people associate with melanoma, and that's actually not sun related. It's a different genetic etiology. This would be an example of melanoma. As you can see, so we talk about the ABCDEs of melanoma. So A is for asymmetry. Does one side look like the other? That does not fit this criteria. B is for border. Are the borders nice, round, and regular, or do they have some weird juts off to the side, which this one would count? C is for color. We like anything that's a uniform brown color. This is multicolor brown, has some red in it, has some really dark brown, like almost black. So that's color. And also, I don't like anything that is just totally pitch black from the beginning, like you took a Sharpie pen and made a mark. There are benign moles called blue nevi that look like a Sharpie pen. But if you were to see anything new that looked like a Sharpie pen, that's what I want to see. D is for diameter. Is it larger than the head of a pencil eraser, or 6 millimeters? There's no marker on here in terms of size, but I would assume that this is larger than 6 millimeters. And then E is for evolution, meaning is it changing? So if they don't meet any of these criteria and you're like, oh, I have this changing mole, I mean, listen to your gut. If you're worried about it, you know, get it checked out. Okay, so here's some other examples of melanomas. This picture sort of got washed out, but anyway, dark, not good. Growing bump, that is very dark, or the scariest kind of melanoma is a amelanotic melanoma, which means it makes no pigment. And that is, again, the scariest kind because you just don't, those are really hard to detect. So again, if you're watching yourself and looking in the mirror and you notice something that's growing, definitely get it checked out just to be sure. Now, there's another kind of skin cancer, which we don't often talk about because it is quite rare, but it is out there. It's called Merkel cell. It is more deadly than melanoma. It is a pink sort of nondescript bump that usually is on the extremities. And it grows, and you biopsy it, it's a Merkel cell, and they need huge, wide excisions and radiation because they're very, very aggressive tumors. So, and these are not from pigment producing cells, so they look pink. They're from the receptor cells in your body for touch. Okay, so any questions so far? Can't see, I guess because I'm sharing my screen, I can't see if there's any questions written in the Q&A.
I haven't gotten any questions yet, but keep start the questions coming.
Yeah, so yes, sunscreens lose effectiveness. If it's past the date of expiration, throw it out. In addition, if you're keeping sunscreen in the car, temperature extremes do break it down. So even if it's the due date is okay, but you had it in the car all summer, just at the end of the summer, throw it out because it's probably not going to work as well anymore.
So I do have some questions now. Thank you, guys. One question that I have, Dr. Brooks, is one, do all melanomas require radiation?
No, actually, melanomas do not usually get radiation in terms of treatment of the primary melanoma. It's usually excision, wide local excision margins, depending on how deep it is, and then a lymph node biopsy. And then, God forbid, it's metastatic, then it's chemo type things, more immunotherapy at this point. But radiation is not usually, when I mentioned radiation, I was thinking more, it's more along the lines of the Merkel cell. Merkel cell will often, most of the time, need radiation unless it's caught super early. That answers it.
Great. Another question that I have is, what is a good sunscreen brand? Is there a brand that you particularly recommend to your patients?
So I say the brand that you use. So if you have to go and look and try them out, test them, because it depends on how, like what your skin type is. Are you oily, dry? What your background color is. Do you need something that's tinted, non-tinted? Some people, the smell agrees with them with different brands versus others. Yeah, I'd say the brand that you use is the brand that I want you to get. I mean, if they're usually the ones that you get from like CVS, they're fine. SPF 30 to 50 is generally what we say is adequate for sun protection. Reapplying it every 2 hours. The mineral-based sunscreens tend to, in my experience, stay on a little bit better. Like if you're exercising or sweating outside, I like those better. If I'm going to be this is me personally, if I'm going to be wearing makeup or something like that, I like the chemical sunscreens better because I think, I mean, they're a good base and they are often mixed with moisturizer to sort of kill two birds with one stone using sunscreen and moisturizer in one. Sorry, how do I look at it? I see these chat boxes pulled up and then they kind of go away and then I can't.
So I've got another question. So the other question that I have is, I tend to get a hard white pimple type things under my skin. What are these? So I'm not sure what that is. I'm just going to say from my own personal experience, I don't know, but we got the dermatologist, so let's see what she thinks. But I think you may need to come in.
So those hard white bumps, I'm assuming, is something called meliocysts. They usually occur on the face. They are basically degenerated collagen that kind of clumps up into a ball and your skin tries to extrude it out, but it doesn't succeed. It kind of stays under there. It's like a little pimple that like just won't ever come out. I wouldn't suggest taking any sort of like sharp object to your face to try to remove those because that can result in infection and scarring. But if they bother you, what we can do when you come in is we can just take a little very, very sharp blade, poke a little hole in, you know, wipe it off with alcohol, of course, poke it with the blade and then extrude the material and it's all gone. And you don't have to look at it in the mirror anymore. I know I do that to my Amelia. I have a chat in here. Okay, someone who died of melanoma. What was it in his intestines? My best friend, melanoma in her back and lungs. It's very sad. So there's two issues here. Number one, the more common thing is that they had melanoma on their skin that metastasized to other places in their body. Now, there are very, very, very rare instances of primary melanoma in funky places, including the lungs, including the intestines, including the anal area, the rectum. You can get melanoma in your eye too, but that is not that uncommon. So yes, one of those two scenarios could have happened. The first one would be much more common than the second scenario, but I'm sorry to hear that. And our skin cancer is more common for white skin and dark skin, and it is always sun exposure related. So no, it's not always sun exposure related. There are types of skin cancer that are radiation related to radiation therapy. So for cancer, there are some that are inherited. It can go along with pancreatic cancer. There are some forms that are related to arsenic ingestion. But the vast majority of skin cancers are related to sun exposure. Basal cell and melanoma are mostly related to chronic intermittent high intensity sun exposure. Like, you know, you're from Maryland and every winter you go to Florida for 2 weeks and you get fried. And that's the most common risk factor for those two. And then squamous cell is going to be like long-term outdoor sun exposure, like you're out in the sun all the time. Now, those are general rules. They're not hard and fast. And the less pigment you have in your skin, the less protection you have, intrinsic protection you have from ultraviolet light. So yes, lighter skin tones are going to have more risk for getting skin cancers if they're not protected. That doesn't mean that you shouldn't protect yourself if you have darker skin tones or you can't get it. It just means that it's more common. I have a brown spot on my thigh for several years, not growing. Should I go to see you to check it out? It wouldn't hurt. Another question is, what products should I use to prevent wrinkles for women over 40? But yes, you should probably get, if you have a spot on your thigh that you're concerned about, and you're like, oh, I don't know if it's changing. Yeah, definitely. I'm happy to see you. And if not me, I'm sure any other dermatologist would be happy to see you too. I want you to get checked out. Let's see, another question, which product should I use to reduce or prevent wrinkles for women over 40? Well, sunscreen is going to be number one. You can see a noticeable difference in tone and texture of the skin after using 3 months of sunscreen on a daily basis. So that's number one. Number two is retinoids. So there's a lot of products that are retinoids over the counter, but a nighttime retinol is going to be a good idea. It can make you a little irritated when you first start using it. And then moisturizer, which is going to sort of plump up some of those wrinkles. Now that's like the very basic. I mean, you can get as fancy or as not fancy as you want with I mean, there's so many things for wrinkles. You know, the gold standard is using Botox. And it definitely does help. Okay. As I'm aging, I have lots of dry, scaly spots on my back. Anything to stop them or make them go away. What I think you're probably referring to is called seborrheic keratoses, which are benign little growths that happen as we get older. Nobody likes them. We could, if certain spots are either itchy or irritated or something, we can freeze them off. They can be frozen off. There is a possibility of making a scar where we freeze it. But I don't have anything to stop them from coming. If I did, I would be really rich, because everyone hates them. You could use moisturizer with a lactic acid base, or alpha hydroxy acid base, which will help to take some of the thinner ones and just thin them out a little bit. But when they get to the millimeters thick phase, there's not much you can do besides freezing to make them go away. Age spots, sunscreen, of course. Someone asked about age spots on the backs of the hands. Yes, of course, sunscreen, minimizing like exposure of the sun. So if you play tennis or something, using one of those that have the sleeve that has the cuff and it covers your hand. And there's laser. I don't do laser, but there are plenty of people around who would be happy to take your money for that, and it works. It does work. And then I have a question: is there anything which will fade hyperpigmentation on darker skin tones? Yes, there are lots of things. It just depends on what your hyperpigmentation is from and where it is. And then we are told to give vitamin D from the sun. Is this true given the risk of cancer? I say that if you can get, so 10 minutes of noontime sun exposure is enough to get you your intrinsic value of vitamin D. You don't need more than that. So 10 minutes, 3 times. The rest of it you have to acquire from your diet. Like you can't get all the vitamin D needs from the sun. You need to have dietary intake. So I would say no, not necessarily. I think you can get it from your diet. Now, if you want to, I think 10 minutes of noontime sun exposure 3 times a week is not going to hurt too much. And then, but I would keep it at that, not too much more. Okay, says, hi, I've previously had and can possibly identify basal cell, squamous cell melanoma. Can you elaborate on possible body locations, depth, and other factors to help identify Merkel cell? Oh, so Merkel cell is very uncommon. I don't know the exact statistics right off the bat, but it's much less common than melanoma. They're unfortunately usually it's on the extremities, but it could be anywhere. And it's a nondescript pink bump, and I can't really tell you much more except for it is nondescript. It grows fairly rapidly, and it's smooth. Okay, so it doesn't have a scaly feel like some of the squamous cells or seborrheic keratoses can feel like scaly or like you could pick them off. Merkel cell doesn't feel like that. It's more of like a smooth area, unless it grows too far and then starts to ulcerate and bleed, which is bad. So, but yeah, that's one of the scary kind. That and amelanotic melanoma are a dermatologist's worst nightmare. What is available besides 5-FU for treatment? I heard about a blue light. Yeah, so I didn't mention that, and I'm sorry, I meant to. Yes, a blue light is another treatment for actinic keratoses. And I do have that machine here. It can be somewhat uncomfortable. The more sun damage you have, the more uncomfortable it could potentially be. Usually it's tolerable. And the good thing about the blue light for precancers is that you come in, you do it once, you come back up 4 to 6 weeks later, do it again, and then you don't have to worry about it. The 5-FU and the imiquimod are 5-FU is twice a day for a few weeks. It can get pretty red and irritated. The blue light is a little bit less irritating than the 5-FU. It can be pretty harsh. But yeah, certainly blue light is a good option for actinic keratoses or precancers. Okay, I use lac hydrin as a body moisturizer regularly. Is this okay to do? Yeah, absolutely. Lac hydrin's great. Is spray better than cream for sunscreen, I'm assuming? And how often is it applied? So no, spray is not better than cream. And in fact, the only time I really recommend sprays is to put like, let's say you're going to the pool, you put a base layer on of cream sunscreen, and then I chase my kids around with the spray sunscreen. Because I think that's the most efficient way, because they're never going to put on sunscreen at the pool with cream, or at least my kids aren't. They just want to run. So I kind of use the spray for touch up and the cream as like a base. But spray is not ideal because it blows away half the time when you're using it. So if you're sitting on an actual beach where it's windy, like half it's going to blow away. Also, if you don't have someone to help you apply it on your back, it's gonna be streaky. You need someone to rub it on. Anyway, and also you don't want to inhale the spray. It's not healthy. How often should you apply sunscreen? It's going to be every 2 hours. And so technically every 2 hours. I like SPF 30 to 50. Sometimes I think, so really in terms of sun protection, there's not a huge difference between 30 and 50, and even less of a difference between 50 and 100. So I think the higher sunscreens are a little gimmicky, but I'll tell you why I think maybe they're good, is that sometimes, we don't always put it on every 2 hours, because life gets in the way. Sometimes that higher SPF of sunscreen will kind of compensate a little bit for the fact that you aren't really putting it on as frequently as you should. So do you need a higher SPF? No, not necessarily, but it might be helpful if you're not perfect. Me. I'm not perfect. I mean, I'm not perfect. That's what I mean. So if I put sunscreen on my face in the morning with skincare routine, and do I need to reapply in 2 hours? That's a great question. So sunscreen, when it's in the sun, when you're in the sun, it like absorbs the energy. And so if you're just going in the morning at 7 o'clock from your house to your car to your office, and then staying inside all day and then going outside, you don't need to reapply it because it hasn't really absorbed the energy of the sun to be degraded. So it actually could still be helpful. So you do not have to reapply if you're doing normal stuff. Now, if you're going outside and cutting the grass, you should reapply it. Skin tags under the arms, are they cancers? Not usually. Yeah, people are pretty good at identifying their skin tags under their arms. So, they're just these little dangly things that hang off, and, they generally don't cause any problems. Sometimes they can get caught on things or shave over them. They can get irritated, and we can certainly take them and snip them off. But if you feel like there's a particular skin tag that's kind of not like the other ones, then, you know, that would be a good idea to get checked out. Will the sunscreen, yeah, sunscreen doesn't really help for like sagging on the arms. I mean, it will help with the pigment and textural changes that come along with sun exposure, but it's not going to like firm things up. That would be good though, if it would. Will sunscreen stop age spots? Yes, it will. I mean, will it stop? Okay, they won't completely stop because you're still going to get older, but it's going to help certainly prevent them and fade the ones that you have there already. So is there a product that will eliminate under eye bags? Under eye bags have a few different causes. One is increased blood vessels under the eyes. Another is that the collagen degenerates, and so the fat underneath the orbit sort of pokes through. And also shadowing from the way our bones shift over time. So depending on the reason for your eye bags, there are certain products that can help. But as I'm sure you've realized, there's tons of products for under eye bags, and usually if one thing works really well, there's not going to be 300 products for it. So nothing works really great for under eye bags. That's but there are things you can do to minimize them, but it just depends on the subtle issue that is making them. Yes, I see patients in Rockville. This is where I am, 7 Lux Road. I mean, this is where I am currently, 7 Lux Road. What causes pink spots to start showing up on my arms? I take immunosuppressive medications for Crohn's. Could that be causing this? I'm just could that be causing age spots? So sure, it could be from your immunosuppressive medications. It's a little bit hard to generalize to say what kind of pink spots you have. So could be anything from like eczema type stuff to precancerous type stuff. It would be better for me to actually see and tell you the real deal. I saw that you said age spots. That is not age doors. Yes, I figured age spots. The immunosuppressive agents should not be causing age spots. No, that should not be happening. Turkey neck. What can I do about a turkey neck? Yes, nobody likes sagging under here. Any non-surgical options? There are some injectable medications that people. I'm blanking on the name right now. Because I don't do tons of cosmetics, but that they inject under here, and it actually does help with that sort of waddle under there. So that's something that you could check out for non-surgical. It does have some downtime associated with it, but I think generally people have got good results. Kybella, that's what it's called. How can sunscreen be kept? How can sunscreen be kept in the cupboard? We never use an entire bottle in the summer. How long can sunscreen be kept in the cupboard? Until the expiration date. That's actually one of the medications where I'm pretty adamant that you have to throw it out by the expiration date because it will expire. I mean, some of the prescription medications, they'll stay for years. I mean, I think I have a tube of steroid that is still good. It's been in my cabinet since residency. So it's like 10 years, unfortunately. It doesn't feel like 10 years ago. Okay, 64-year-old female, and I've been losing my hair and my eyebrows. Can this be treated? Yes, absolutely. There are several reasons for eyebrow hair loss, from benign, to like, alopecia type things. So again, that's a question that's sort of better answered if I can see it directly and take a look. And do I need to wear sunscreen if I just drive to work and stay in the office the entire day? Does the windshield block the radiation? So the windshield does block UVB. It doesn't block UVA. There's two wavelengths that we're talking about here, UVB and UVA. And that kind of simplify it by saying like A is the aging ray and then B is the burning ray. So the window will block the burning ray, but it doesn't block the aging ray. And I would say that it would be a good idea to use sunscreen if you just drive to work and stay in the office, because not only just for skin cancer, but aging type stuff, it will help with that. Should we apply sunscreen under the eyes? Yeah, right up until the orbital rim, like where you feel the bone there. You don't have to put it literally directly up until the eyelid, but the bony part right here. Okay, I think I got to the end of my chat on there. Oh, on eyelids. To right here. I wouldn't do it like on the eyelids here, but to the eye, like the rim, the bony rim. Okay, so I'm going to hang on. Sorry, does anyone?
I don't see any more questions.
Okay.
Well, I'm sorry, there's actually some more. Wow, you guys are coming in. This is awesome. I have, if the sunscreen does not have an expiration date on it, how long can it be expected to be effective?
Okay. It's hard to say. If it's a mineral-based sunscreen, now the question is when you got it. So if you got it like 5 years ago and you don't see the expiration date on it, I would still throw it out. But if you got it this year, it doesn't say the expiration on it, I would wait, just wait till the end of the season, and then when you're done, like throw it out. But if it's a mineral sunscreen, those with no chemical sunscreen mixed in, that would be those last a pretty long time. And that's like the old like stuff that they used, in the 70s, the lifeguards, the white, that's mineral sunscreen, and that'll last. Sorry, there was another.
So yeah, the other question I sent you, there was one about, I have super dry lips. I use Vaseline, Aquaphor, Blistex / Medex, Dr. Dan's chapsticks, but need to do so at least every hour.
So the approach to dry lips is a few questions that I would ask is, what do you wear on your lips? So you provided me exactly what you do. What do you use for toothpaste? Do you use lipstick or lip gloss? Or do you use mouthwash or any sort of, like, do you floss with flavoring? Do you pick at your lips? And so it could be sun damage, because sun damage can cause what we call actinic cheilitis, which is sun-induced skin peeling. Then you have, so that's one reason your lips could be peeling. Could be allergic contact dermatitis from something in toothpaste or any of those other type things that are going in your mouth, as well as things that you put on your lips. I do not recommend, if you have really dry, scaly lips, to use Blistex or chapstick. They have preservatives and fragrances in them that can bother lips. Vaseline or Aquaphor only, nothing else. And I say that I do that for like 6 weeks. No lipstick, no lip gloss, no lip liner. Yeah, so the answer is it's not always like, don't do this or don't do that. It's kind of like let's see what you're using and what we can change. Also, I tell people a lot of times to use to switch toothpastes that they're on depending on what they're using. So All right, can you talk a bit about hyaluronic acid, its benefits, amount required to see results, how often to use, what products are most effective? So hyaluronic acid is a nice moisturizer. It's hyaluronic acid is what it holds the moisture in our skin, and it makes it more plump. And in fact, that's what fillers are, is basically hyaluronic acid that we just inject in the skin in areas that we want to fill up. But topical hyaluronic acid is a good moisturizer. I generally say 1 to 2 times per day. All of the topical stuff, you have to be using it for, 3-6 months to notice a benefit for them. And generally, in terms of like products, I mean, Neutrogena makes a Hydro Boost gel, which is a good one. There's Replenix. There's different brands. I had one in my head that I was just thinking of, but now I'm blanking on it. Anyway, hyaluronic, The Ordinary. That's right, The Ordinary. I like that site. They have good products at a good price. Okay, do I have any suggestions for male pattern baldness for a 25-year-old? Rogaine does not seem to be very effective. Yeah, so definitely Rogaine is the first thing. There are compounded Rogaine that's a little stronger than the ones that you can get in over the counter, that are 7%, that are more effective than the 4%, but it's not cheap. There's finasteride, which is Propecia, which you may or may not have heard of, and there are some other things like PRP injection. People are starting to use oral minoxidil actually for hair loss. So that's something as well. Just depends on how aggressive one would want to be with it. By mineral-based sunscreen, do you mean zinc-based? Yes, zinc oxide, titanium dioxide, one of those two.
So I don't have any additional questions that I've received yet, Dr. Brooks, but I wanted to ask you a personal question. Well, ask you a dermatologic question for my own personal edification, which, you are very politely allowed to reply, like, I need to come into the office and be seen. But I am allergic to sunscreen. Like, and it is the weirdest thing. Like even like lip gloss or like even like Vaseline that has SPF in it, like I cannot wear it. Like it literally starts breaking out like with hives around my lips, like these like bumps, and then it gets worse. I was a hot mess when I was in Barbados like a few years ago because I was trying to wear sunscreen and I ended up having to take Benadryl. Liquid, of course, because I was sipping on the beach. Anyway, so do I then go for a mineral one?
So yes, so the most likely thing is that you're allergic to some component of the chemical sunscreen. And yeah, use a mineral one. That's the best option. I know, but there are some really good tinted mineral sunscreens out there now. So you don't have to suffer with being super pasty. I mean, there are some good mineral-based ones, and so Elta MD makes a good tinted sunscreen.
Okay.
So there's options for you. You don't have to get burnt.
So because I don't want to get burned, but I do want to enjoy my sun. So how do I go about scheduling an appointment in this pandemic time? Like, how do I get in to see you? Because, I don't want to do just a drive by and just drop up there. I figure I should go through the proper channels. So how do I schedule an appointment with you?
Sure. So the easiest way is to call the call room and call the office and say you're a new patient. And if you are having if you need just a general skin check, and there's nothing that you're particularly concerned about, but you just want a general skin check. The wait is a little while, but I do take new patients. So if you're not having an urgent issue, then just, if you wouldn't mind to just wait a little bit, then you can call, but it'll be a couple weeks. If you're having a certain problem that you feel like you're worried about something that's new or changing, then, and you're a new patient, just call the office and ask them to send me a message, and I will usually be able to accommodate you if you're worried about something. And yeah, that would be the best way. Or if you're already an established patient and this is something that you're worried about, if there's something that you're worried about, you can send me a portal message or call the office. But yes, that's how you make an appointment with me, is to
So call the call center if it's just a general skin check. So I'll start telling my patients to expect a little bit of a wait like that, but it's kind of the post-pandemic time, everybody's wanting to get in, so you're a little full. So I definitely tell my patients to wait. There's not a rush or an urgency for a general skin check. But if it is something that I'm worried about, like a mole that's enlarging,
please,
or something like that, say, hey, can you send her a message to tell her I have this concern? Would it be helpful if I took a picture on my phone to upload to that portal message?
Yes, I love pictures. Pictures really. So I'm doing a little bit of telemedicine just because, with everybody had not been vaccinated and stuff. So it's just keeping a little bit of telemedicine there to the people who were comfortable coming in. But pictures there are better actually than telemedicine sometimes, because it's not pixelated. I usually tell people, if you want to send me a picture, just try to make it well lit and in focus. And if that means you have to have somebody else take the picture while you pose your mole, then do that and then send it to me, because when a virtual visits, a lot of the time, people are moving around and it keeps going in and out of focus. So I say a good picture is worth 1,000 words. So yes, if I love pictures, so it helps me a lot.
And do you only see adults? Do you see children?
I see children also. I see adults and children. Now, I'm not a pediatric dermatologist I didn't go on to get the extra year of certification in pediatric dermatology. But in terms of regular eczema, rash, I mean, that was plenty part of our training. We're kids. I mean, eczema, acne, I mean, it's pretty bread and butter.
Great.
Stuff. And I love acne. It's fun. It's fun, very fun to treat acne.
Do you do any cosmetic things? So for example, I have areas of hyperpigmentation from, picking, I'm going to show it to everybody. And so are there certain cosmetic things that you do that may not necessarily be covered by insurance, but, are in your wheelhouse to kind of help with certain skin issues?
Yeah, so medically related, but not exactly cosmetic, things like skin tags that are asymptomatic, or the seborrheic keratoses that nobody likes, but it's not symptomatic and insurance really doesn't cover it. So I'm happy to do those types of things. And then I do Botox to keep my skills up. It's fun. People are very happy. Botox is great. And I do some chemical peels for some medium and light chemical peels for tone and texture improvement, as well as dark spot improvement. And I will do some chemical peels, more aggressive chemical peels for people who would like that for actinic keratoses, because it helps with the precancers, but also gives some cosmetic benefit. Insurance won't cover it because I'm doing the peel, and that's not they won't cover it if you do a peel. Like if you, you know, it just makes no sense. But anyway, they won't cover it. If there's any side benefit of any potential cosmetic improvement for you, they will not cover it. But I will do it because there are some with the more aggressive chemical peels. Yeah, so I had been in the past doing some filler, which I sort of got out of during the pandemic because there were other medical problems that were important. So, but anyway, yes, I do some cosmetic stuff and things that, you know, I'm happy to always be like an impartial sort of voice to tell you where to go and what you probably need, without feeling like I'm selling somebody something, because I don't even have it. So, but I feel like I can tell you the right way, the right place to go. And yeah. Oh, hang on. I got one question here. I think I may be allergic to mascara. My eyelids get dry and itchy. Do you have any suggestions for a brand? I use Almay hypoallergenic. I'd have to look into it. Right off the bat, I can't tell you a brand, but now it would be helpful to know if the Almay hypoallergenic does the same thing to your eyelids. And because if it doesn't, then good, yeah, great, it does. Okay, yes, it does. So, yeah, I'd have to look into, actually, you'd have to give me a few minutes to think about what brand you could try, but there's definitely some that we could.
Okay, well, it's getting close to our turning into a pumpkin and going back to, you know, work lifetime. I want to thank everyone that joined us. I definitely especially want to thank you, Dr. Brooks, for doing this for me, because this is definitely a talk that I could not have tried to figure out how to do. So I definitely appreciate you stepping in and doing this. I think it was very successful in that a lot of people had a lot of great questions, which I think also means that you guys need to come on in and see our dermatologists. We have two, and they are ready, and they are taking both of them are taking new patients. So if you can't get in with one, please, you can always go see the other. They work well together, so you can kind of, I know I'm probably speaking stuff that you probably already know, but you know, we're all one big happy family. So come on in and see us, and see Dr. Brooks and Dr. Sarah Polly. And I would say, you know, before we close out, what would be the one thing that if you could make every one of your patients do this one thing to like take care of their skin, and it would just make your life so much easier, what would that be?
I would say put sunscreen on your face every day.
Okay.
That's what I would say.
All righty. So everybody, let's go out and get some sunscreen so we can make Dr. Brooks proud. I'm even going to try to find me a tinted mineral-based one, but if I look pasty, just say I had to do it because Dr. Brooks told me. So you guys don't forget, we have another webinar next Friday. So hope you guys will join us for that one, and have a great weekend, you guys. Thanks, Dr. Brooks.
Thanks.
Bye.
Bye.